Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Equipoise. This audio podcast is part of a lab storm motley. This audio podcast as part of a storm and skull and turbulence. This audio podcast as part of the Squakish series series or edition, and this audio podcast as part of a storm logistics production. Through this audio podcast, I look at and around renal and peer support. So before going forward, this audio podcast is a sort of a generic overview of in around sort of peer support. There is the audio podcast will not sort of delve into sort of any particular overall initiatives. However, that being said, there is a sort of overall presentation version of this audio of this sort of audio podcast in through the RPSG organization. And so on that bit on that regard, the the overview in this audio podcast is and will be sort of generic. So in regard in a part of peer support then. A diagnosis of CKD or chronic kidney disease can be devastating and can cause sort of physical and emotional changes with accompanying challenges. Peer support is recognized as an important component, if you like, of quality of quality in around QOL or quality of life surrounding RRT, for example, renal replacement therapies, and in, for example, preparing recipients in around SOT or solid organ transplantations. Thusly, peer support additionally is a multifaceted concept which depends also on on context and use. The sort of in around the focus of peer support, around the focus of peer support is being able to communicate and have and share lived experiences, gaining sort of confidence and more sense of control in around shared experiences, and having access to practical information based on sort of the shared experiences. Ultimately, for where CKD recipients for CK and where for CKD recipients can from the shared experiences or lived experiences can use the shared experiences to inform healthcare decisions and shared decision making as part of their healthcare processes. In as part of peer support, additionally, support exchanged by recipients uh, by recipients um, around different aspects around different aspects of healthcare is and can be helpful. Peer support is also in its construct, which this audio podcast will not go into and will not go into to we're not delve into too much we'll not delve into too much, but it is where the construct in around peer support is highly variable. It is best when recipients and healthcare professionals, for example, however, work together surrounding specific aspects of both lived experiences and diagnoses. Peer support additionally can enhance self efficacy through both through both experiences and connectivity. Friends and family can can increase a recipient's isolation and distress by offering unhelpful assistance at times, and such as additionally as unwanted advice, or false reassurance. Whilst peer support can offer opportunity, peer support has also been postulated to be advantageous in a range of physical and emotional settings. In around the advantages of peer support, peers have a unique authenticity which enables recipients to compare, validate, and share lived experiences. Peers, peers, or those, or where peers can provide real world knowledge and experiences regarding different experiences of in and around healthcare. Emotional assistance is and has been evidenced as important, and where emotional assistance is and has been referred to as a sense of reassurance, and where reassurance and encouragement that peers can offer and can offer and can be useful between both patients and healthcare professionals, once experiences are shared. It can also peer support can also be introduced as a as flexible, which makes it ideal to tackle real issues in around CKD. In around lived experiences, peer support has been implemented for a range of different long-standing or long-term conditions. Peer support can be advantageous in helping recipients with CKD make treatment choices, for example, and alleviate anxieties about care plans. Hearing about good and bad experience can prompt more informed healthcare decision making. In around the generic or general effects of peer support, there are several effects. So, for example, it can prompt having control, a sense of reduced uncertainty, prompt empowerment, being understood and accepted, being less isolated, have a sense of normality, and additionally having a where one of the final effects is in around where it can peer support can prompt positivity and possibilities. So that draws this audio podcast to a close. This audio podcast as part of the Equipoise. This audio podcast is part of a Lapstorm Motley. This audio podcast is a part of a Storm in Scotland Turbulence. This audio podcast as part of the Squakish Series and or edition.